Welcome, everyone. I'm gonna start by killing a little time because I'm really hoping our co-host, Larry Gostin, will be here to welcome you as well. We are so grateful every year to be able to meet in this wonderful, intimate space at the Georgetown Law Center, and we're very, very grateful for Larry and the O'Neill Institute's support of this summit year after year. So I'm Deborah Peel, and I'm the founder and chair of Patient Privacy Rights, and you all are the people that make this summit possible. Thank you so much, speakers, guests, and friends and family, and I want to particularly at the moment note that Microsoft is our gold sponsor this year. We're very grateful to their help and to the Dewey Square Group for helping get people in and registered. Thank you to both of them. We have academic partners. We have consumer group partners. You can see them up here. I just want to thank you again and talk about two or three things. The summit this year, we've done something different. We've decided to talk very specifically about the value of healthcare data outside of healthcare, as well as inside. I think that's a distinction that a lot of us in healthcare don't think about. And many people in healthcare and health IT don't even realize how much health information is far, far beyond where people would expect it to be in the offices of their physicians, their health professionals, hospitals, and so forth. Health data is everywhere. Of course, is this accurate to say we're swimming in data? Data about us is everywhere, and in particularly in the U.S., the only rights that people have still on the books, legal and ethical rights, are rights to control their personal health information. But technology has moved faster than ethics and the law, and we've lost control. And so we're going to specifically look today at the bigger picture, health data in the larger world. So I think that's a really important distinction to make and to think about, that our health data isn't just in the hands of the people that we go to seek help from. So tomorrow we're going to focus on the value of health data inside healthcare. The value of using data is absolutely indisputable. Indisputable. We can do things with technology we could never do with paper. Would never be possible to look at some disease in 1 million people. And we need to be able to do that. But the chances for harm and damage are also magnified by technology, and that's what we're looking at, and that's why I hope everyone is here today to work together to find solutions. And this is a really auspicious year for privacy and for health privacy in particular. We had a new omnibus bill, privacy bill, come out in February. Interest in privacy and the use of data is really, really ramped up. This is really an amazing year for patient privacy rights and for the summit, because we have the European Data Protection Supervisor here as our opening keynote, and I think you will be so excited to welcome him. I will say a few more things about him in a minute. It's also, for me, an auspicious day. It's my mama's 90th birthday. And so I'm thinking a lot. I'm thinking a lot about my family. My husband's here, as always, supporting me. Larry, you can say hi to him later. Any of you who do any work in the world know that you can't do what you love and what matters to you unless your family's with you. And this work, for me, is very much about my family. Our children and our grandchildren, and making sure that they have the same opportunities we had, because we had the right to be forgotten growing up. It's a very important family issue, I think, for all of us. So I guess Larry Gostin. There you are. Oh, Larry, please come up. I'm sorry, I wasn't watching. Anyway, Larry, come up and say a few words, and then we'll introduce Peter. Thank you. I didn't see you. Sorry.
It's okay.
Okay.
Good morning, everyone. Hi. Well, welcome. On behalf of Georgetown University Law Center and the O'Neill Institute for National and Global Health Law, I join in Deborah's welcome to you. The O'Neill Institute is devoted to finding innovative solutions to national and global problems of health, including privacy, and we work all over the world on a whole variety of issues. This is the third summit. It's been a marvelous partnership between us. I think Deb is right that this is a very important year for privacy. One of the things I would mention in addition is the implementation of the Affordable Care Act, which is going to be rolling out, and all of the discussions that are going on around privacy and also security of data, which are really critically important. And big data is just part of the world, and in fact one of the reasons I'm having to leave now is I'm chairing a National Academy of Sciences committee just down the road, where we're talking about really important issues of genomics. And as we know, the genome is something that can produce a wealth of information about each and every one of us and is actually, in the end, identifiable. So I know you're going to be working hard on this problem. It's a terribly important one. And I just wanted to end by thanking Deborah Peel and Patient Privacy Rights. I think it's very obvious, not just for personal reasons, but for all reasons, that the passion you show and the commitment and the leadership is unsurpassed in this field. Thank you all for coming. I wish you a really productive and engaging time, and I will then now turn it over to you.
Thank you.
You're welcome.
Thanks so much. Thank you. Thank you so much.